is a modified anterior stainless steel crown that is advent of composite bonding allowed for a composite facing to be placed on the facial surface of the tooth, thus improving aesthetics. Open face stainless steel crowns combine strength, durability, and improve aesthetics. Composition: stainless steel crowns consist of 17 to 19% chromium, 9 to 13% nickel, and 0.8 to 0.1 carbon. Nickel is one of the most common causes of allergy reactions or allergy contact dermatitis and produces more allergy reaction than all other metals combined. There may be risk of sensitizing patients to nickel with long-term exposure to nickel-containing appliance as an orthodontic therapy. Advantage of open-face stainless steel crown: it has high durability and retentiveness, aesthetically fair, materials are inexpensive. Disadvantage: extremely poor aesthetics kasi nakikita pa rin natin yung metal niya sa likod. The procedure is time-consuming. It is a two-step process. Crown cementation and composite placement. Placement of the composite face may be compromised with gingival hemorrhage or moisture is present or patient is not cooperative. It is extremely technique sensitive. Indications: extensive decay in primary and young permanent tooth. Single tooth cross bite. If the restoration is needed to last more than 2 years, if the child is less than 6 years old, following pulpotomy and pulpectomy procedures, localized or generalized developmental problems such as enamel hypoplasia, restoration of fractured molars. Contraindication: if primary molar is close to exfoliation, with more than half the roots resorbed, tooth exhibits excessive mobility, partially erupted teeth, and a patient with nickel allergy. Okay, tooth preparation. Medyo madugo yung tooth preparation niya. Always check the occlusion before stating tooth reduction. Occlusal surface should be reduced 1 to 1.5 millimeter and create a channel 1.5 millimeter deep between the cusp. Reduce the cusp to the depth of the channel. Prepare a slight bevel at the occlusal 1/3 portion of the surface by 45%. Round off all line angles. Break proximal contacts as appropriate depth. Vertical proximal walls with slight convergence in an occlusal and lingual palatal direction. Feather edge finish line. Common error is ledge formation. Clinical procedures for stainless steel crown. Crown selection. If possible, select the smallest crown that restores the pre-existing. Common size used is a size number 4. Crown which are too big mesiodistally may prevent the adequate eruption of adjacent teeth. Kasi pag malaki yung when the crown is very big, sometimes lampas siya sa cervical area ng ipin ng kanyang abutment. So yung edge ng crown nakahang sa edentulous area or dun sa area na tutubuan ng premolars. So sometimes hindi makalabas yung premolars kasi nakatuon pala yung hindi makalabas-labas yung ipin that would erupt because nasasanggahan ng crown. So two-way preparation kasi ang open face stainless steel crown. You will process the stainless steel first and then tatanggalin mo, i-drill off mo yung metal. While, i-drill off mo yung metal and then yung facing, tatanggalin mo siya kasi papalitan mo siya ng composite. So, masyadong very impractical yung procedure. Crown adaptation, examine the crown for sharp angles or irregularities, recontour or recrimp if necessary, and examine the occlusion before you can cement. Class, nai-imagine nyo naman yung ngipin, ano? Ito. Gagawan mo muna siya ng stainless steel crown. And then, after that, i-drill off mo yung labial surface. So, magiging ganito. And then, magpapak ka ng composite. So, that is how you do it. Polycarbonate crowns. Ang polycarbonate crowns are just like yung jacket crown nyo na made up of plastic. This is pre-formed already. You will just take an impression of your case, you make a cast, dala-dala mo yung cast dun sa store where you can get the polycarbonate crown, and then isusukat nila yon. Bibigay sa'yo. So, plastic jacket crown ang dating. Pero it's polycarbonate. Pre-formed na siya. Nabibili mo na lang siya. Katulad din siya nung celluloid strip of crown. Mabibili mo lang. Tapos ito rin. Dami namang excess cement nito. Pangit. Anyway, mas maganda, mas magaan ang polycarbonate. If you will be putting crown on a temporary tooth, polycarbonate crown is good enough, especially for anteriors, than open face stainless steel crown. Kasi gagawa ka pa ng stainless steel crown, babakbakin, tapos nakaka mo pa i-build up ng composite, masyado matrabaho. And mind you, children have a short pasensya. Indications, rampant caries involving 3 surfaces of the tooth. You can also use it after pulpal therapy, tooth malformation, abutment for space maintainer. Contraindication, when there is inadequate spacing between the teeth. Crowding of anterior, deep impinging bite is present. Severe bruxism, hindi rin pwede. If you have bruxism, hindi ka pwede sa crown na polycarbonate. When there is evidence of abrasion in the anterior teeth. Advantage, aesthetically acceptable kasi puti. Less chairside time kasi nabibili mo na siya pre-formed. Improves retention, flexible, better adaptability. Disadvantage, breakage kasi plastic lang siya. Dislodgement, natatanggal sometimes. Discoloration, techniques sensitive because you deal with cements. Require adequate hemorrhage and moisture control. So you reduce incisal edge minimum of 2 mm. Reduce labiolingually with a minimum of 2 minutes. Place the 2 millimeters. Place the finish line subgingivally. Subgingival. So, pasok sa, di ba we have the subgingival, equigingival, and supra. Reduce interproximally until the contact is broken. Remove all carious lesion and perform pulp therapy if needed. When do you do pulp therapy? When you reduce the tooth and you are very near to the pulp already, then you do root canal. Now, crown technique. Select a crown that fits easily over the prepared tooth and has the appropriate mesodistal width. A trial fit is carried out to check for proper fitting, marginal adaptability, overall coverage, occlusal interference, and mesodistal width. If the crown does not sit without incisal interference, additional tooth reduction is required. Necessary adjustments are made to polycarbonate crown using either a crown cutting scissors or trimming stone. After the final fit is done, the crown is relined using a self-cure acrylic resin. It can be bonded to the tooth using composite resin or GI. Resin veneer crowns. Stainless steel crown with white facings are resin veneered crowns that combine the durability of a stainless steel crown and the aesthetic of a resin facing. They are less sensitive to hemorrhage and moisture during placement. Their limited crimp ability requires a greater removal of tooth structure. More expensive than SSC, composite strip, and polycarbonate crowns. Advantage, durable, good aesthetics, insensitive to hemorrhage and or moisture. Disadvantage, higher cost, limited trimming or crimping of the crown, and potential allergenicity. Resin veneer crowns. Indications, extremely decay in primary and young permanent tooth, single tooth cross bite, if the restoration is needed to last more than 2 years, if the child is less than 6 years old. Following pulpotomy and pulpectomy procedures. So, when you do crowns, when you do pulpal treatment on a tooth, kasama ang crowns as your final restoration. Kasi it depends. Pwedeng ang final restoration mo ay build-ups. It can also be crowns. Localized or generalized developmental problems such as enamel hypoplasia, restoration of fractured molars. Contraindications, if primary molar is close to exfoliation with more than half the roots resorbed, tooth exhibits excessive mobility, partially erupted teeth, and in patient with nickel allergy. Okay. Preparation. As you can see, all the preparations are done under isolation. Reduce occlusal 2 mm with a coarse football diamond or donut diamond burr. Reduce mesial and distal with fine tapered diamond burr or 169L carbide burr. Preparation. Reduce buccal and lingual with coarse tapered round end diamond or carbide burr. Extend a circumferential feather edge margin about 2 mm subgingivally with a fine tapered round end diamond burr. Okay. So how to prepare? Check that occlusal reduction is 2 mm before try-in. A 2 mm thick donut diamond burr may be used to check the depth of the reduction of the margin of the adjacent primary molar. So, you check with kung walang opposing, okay lang. Pero kung meron, you check your bite together with your, before you prepare. Class, when you do crown, yung stainless steel crown natin na gagawin nyo sa PEDO, ang reduction on the occlusal is only 1.5. Ang reduction on all sides ay 1 mm and then ang occlusal ay 1.5. Why do you think dito sa resin veneer crowns 2 mm? Kasi ang metal class and stainless steel crown napapanipis. So, kahit konti lang ang bawas mo, okay lang. But for resin veneer crowns, yung mga may build-up, yung parang porcelain fused to metal crowns, yun ay mas malaki yung reduction mo, 2 millimeter. The one you see at the picture, I forgot the name. Ito yata yung donut burr. Placement technique. Crowns are possibly seated with light digital pressure. Fill the crown completely with GI cement or cement of choice to prevent voids. The crown is seated passively with finger pressure only. There is no snap fit as with traditional SSC, and the collar cannot be crimped. The crown collar should be subgingival. So walang snap fit. Ang snap fit class, yung parang may resistance yun when you are fitting crowns. May resistance siya sa katabi. Nagkakaroon siya ng snap sound. Ibig sabihin, nakuha nung maganda yung kanyang fitting pag may snap sound. Zirconia crowns. This is very expensive. Pero there are parents na gusto talaga nila kahit temporary tooth ay zirconia. Pero ako, I don't advise because this is quite heavy on the mouth. Prefabricated, exceptionally strong ceramic crown that offer the most aesthetic by compatible full coverage primary molar crown. Kasi sa akin, ang temporary teeth will go when it's time to go. So sayang naman. Ang mahal kasi ng zirconia. Where is comparable to natural teeth? Anatomically contoured and metal-free. Kaya maganda. It's an all porcelain crown. No, actually not porcelain. Zirconia crowns. Tingnan nyo dito sa picture. So, hindi siya masyadong halata. Advantages, exceptional durability, excellent aesthetics, kasi parang tunay na ipin. A disadvantage, high cost, inability to contour, increased operatory time for placement. When I install zirconia crowns or all ceramic crowns, and sometimes, kalahating araw ko yung isi-cement. And toxic na toxic ako. Medyo, siya, techniques sensitive. Dali, ha? So for class, may question kayo? Dali lang, ha? Wait a while. Wait lang. Dodo, I'm having my class. Nagkaklase ako. Okay. About what? But if you can see on the picture, ang zirconia crowns kasi talaga ay natural looking talaga. Maganda talaga siya. But expensive. So again, 2 millimeters, 1 to 2 millimeter ang occlusal reduction. Para ka ring nag-jacket crown ng adult tooth ang abutment prep. Although the margin should be subgingival or equigingival. So yung circumference naman niya, babawasan mo ng 0.5 to 1.5 millimeter. Yon. Placement, completely fill the crown with resin-modified glass ionomer, RMGI, or GI cement to eliminate voids. Sit the crown subgingivally with digital pressure only. Do not permit the patient to bite the crown down into occlusion. The crown should best stabilize with firm finger pressure during the cement setting time. Pag nagsisiment kayo ng ganito, when you apply digital pressure, kailangan hindi gagalaw ang daliri mo. Kasi hanggang hindi fully set yung cement sa loob, hindi mo siya dapat bitawan. So these are the references. Thank you. Do you have questions, class? Regarding crowns? Commonly used crowns for children ay polycarbonate, cellulose. Unang panahon, I can see kids when I was still young. Yung mga bata, naka-metal crown even at the anterior teeth. Kasi maganda siyang tingnan eh. Pag smile, mukhang mukhang alien. Kasi kulay silver ang anterior. Pero yun ang uso noon. And it's just fine. But now, since nauso na yung resin, nauso na yung ceramic facing, the ceramic facing, when you say ceramic facing, ang preparation niya kalahati lang. Labial surface lang. Hindi mo maraming klaseng crowns, but we don't use those crowns na. Special crowns yon, pang adult lang yon. For PEDO, we only have celluloid strip off, open face, stainless steel crown, polycarbonate, full metal yung stainless steel crown, and zirconia. May questions kayo? Class, with regards to exam, kung kailan kayo convenient, na kayo ay makakapasa. Kailangan ipasa nyo ang subject ko. Otherwise, mal-delete kayo ng isang taon. Kasi ang PEDO is only given during the first semester. So, marami kang hindi makukuha kapag hindi ka pumasa. Another thing, surgery. Hindi ka makakakuha ng maraming subjects kapag binagsak mo yung surgery. So, ipasan nyo pareho, ha? Okay? May questions pa kayo? Yes?
Regarding po dun sa oral rehab po, January na lang po yung majority po na gusto ng klase po.
Yan. Okay lang sa akin.
Okay po, Doc. Thank you po.
Basta ang oral rehab, isang araw lang ang ating i-consume. So, magpiprepare na kayo ng typodont na may alkyl-positive sari. Basta huwag lang gagamit ng oatmeal kasi yung oatmeal, hipan mo lang, natatanggal na. Ipasan nyo ang subject ko, ha? Huwag na hindi. You have questions? So, mag-good night na ang Doktora Jo. Kung wala na kayong questions. Medyo not feeling well na ako. Gusto ko lang matapos yung ating ano. So, may next meeting pa ba tayo? May? Papagtiwanan ako ng calendar. Do we still have next meeting?
Yung 14 po, Doc.
14. Gusto niyo sa 14
Wednesday
yung
po.
mag-exam? Pwede na tayo mag-exam sa 14 actually. Para makapag-vacation kayo ng Christmas vacation na maayos. Ang walang isipin. Sige, pag-isipan niyo mabuti ha. I just need to go na. So, good night. Good night, class.
Thank you po, Doc.
I see you.
Thank you po,
Ingat kayo.
Doc.
Yeah, good night, class. Good night.
Good night
Thank
po.
you so much. Thank you. Thank you so much. Bye-bye.